Welcome and peace be with you. In this session on the principles of Tibb, we're going to discuss how illnesses develop. Now, the Tibb principles of creation, qualities, physis, temperament, humours and lifestyle factors, as described in the links of the principles of Tibb, allow for a comprehensive understanding of not only health maintenance, but also interpreting how illnesses are caused. Tibb recognizes that illnesses do not just happen but are the result of causes that can be identified. From Hippocrates, who established the principle of cause and effect. Hippocrates established the scientific basis of health and disease when he hypothesized the principles of cause and effect. The case study on the next slide highlights that most illness conditions can arise from different causes. Let's look at the scenario. That example of Mr. Robert M., age 55, somewhat overweight, smokes 30 cigarettes a day, drinks heavily at weekends, exercises very occasionally, and is a mild type 2 diabetic. One day, after a difficult time in the office and after having an argument with his daughter in the evening, he suffers a non-fatal heart attack. Now the question to ask, what caused Robert M.'s heart attack? Was it the emotional stress brought about by his confrontation with his daughter? Was it his atherosclerotic plaque in his coronary artery, preventing adequate blood flow to the heart muscle? Was it a blood clot formed in the leg but carried to the heart by the bloodstream where it became stuck in the artery? Was it his inactive lifestyle? Was it his genetic composition or temperament? There is, in this case, a series of possible causes, any one of which could be responsible for his heart attack. Now, this scenario that we highlighted invariably tell you that most illnesses can have identifiable causes, and in the light of which a possible cure. And the question to ask, can illnesses be reversible? So let's just delve into it more. From the above, it is evident that most illnesses have identifiable causes and therefore can have a possible cure, dependent obviously on a person's age, state of health, extent of damage to organs and tissues, and compliance to treatment. In addition, as mentioned in the link on physis, that after the approximate age of 40, the ability of physis to restore homeostasis becomes weaker. This could invariably lead to illness conditions, especially chronic conditions, manifesting itself. Tibb philosophy therefore maintains that most illness conditions acquired after normal birth should be reversible up to an approximate age of 40. Now let's discuss the relationship between temperament and its predisposition to illness conditions. As mentioned in the link on temperament, the dominant quality associated with an individual's temperamental combination provides variable insight into the predisposition to illness conditions. For example, an individual with a dominant sanguineous, subdominant phlegmatic temperament having an overall quality of moistness will invariably be predisposed to illness conditions associated with the excess quality of moistness, as in the case of type 2 diabetes. Similarly, someone with a dominant melancholic and subdominant bilious temperament will be predisposed to osteoarthritis, which is associated with qualities of cold and dryness. The link between the dominant quality and the predisposition to illness conditions having a similar quality, especially from infancy to adulthood, has been confirmed in the research conducted at the Tibb treatment centers in Cape Town. Let's talk about qualities associated with illness conditions. Most, if not all, illness conditions begin with an excess of one of the four qualities of heat, coldness, moistness, and dryness, as well as the second associated quality. An example of this is a common cold, which typically develops in the cold season of the year. If this cold imbalance is not corrected, cold and flu-like symptoms develop and are often associated with an increase in mucus production, runny nose or congested nose, and also a productive cough, etc. Therefore, cold and flu are associated with qualities of coldness with moistness. Similarly, constipation is linked to qualities of dryness with coldness as intestinal motility slows and the level of fluid is low, resulting in the formation of dry, hard, dehydrated stools. The slide that you see now gives you some idea about qualities associated with different conditions. For example, cold and flu has got a quality of cold and moistness, with cold being the dominant quality. Similarly, osteoarthritis, also cold and dry, with cold being dominant. Hyperacidity or ulcers is hot and dry. Osteoporosis, cold and dry. Diabetes type 2, moist with heat. Asthma, phlegm-related, obviously, moistness with cold. So every illness condition also has got identifiable qualities associated with them. Let's talk about the difference in pathology from a Western perspective as opposed to the Tibb perspective. First of all, what is pathology? Pathology is the study of the process by which diseases develop. Now, in Western medicine, pathology is concerned with the causes, signs and symptoms and diagnosis of a disease. That is, the focus is on evaluating the pathological processes, either with blood tests, X-rays, CT scans, in relation to the signs and symptoms, as well as structural changes to tissue organs in the patient. Now very different in Tibb, unlike Western medicine, pathology begins when the ideal state of the humours in relation to the ideal qualitative state required by an individual's temperamental combination is changed to an extent that physis is not able to restore balance or homeostasis. Now let's list the different pathological processes in Tibb. Firstly, by means of a sudden change or excess in qualities from lifestyle factors. Secondly, from an accumulation of excess or abnormal humours. Thirdly, from infective agents, obviously exposure to bacteria, virus, etc. And finally, from the unwanted side effects of conventional Western medication. Let's analyze the first one, from a sudden change or excess in qualities. Example of a sudden change in qualities resulting from lifestyle factors is when an individual goes from a warm environment into the cold without being warmly dressed. He or she will most likely experience symptoms of the common cold, runny nose, watery eyes, shivering. Similarly, if an individual partakes in spicy hot foods that he is not accustomed to, they will start perspiring. So in both scenarios, we have the example of a sudden change in qualities. Let's talk about examples of an excess of qualities. This is when an individual, due to circumstances, has not slept for more than 24 to 48 hours. Similarly, if a person is not accustomed to outdoors and spend long hours on a hot day. So this excess of exposure to qualities will lead to certain signs and symptoms such as fatigue, headaches, etc. Now in both instances, whether it is a sudden change or excess qualities, if the negative influencing factors are removed, then physis is able to overcome the sudden excess change in qualities and restore health. Illnesses in this category are mostly self-limiting conditions such as the common cold, mild diarrhea, indigestion, and headaches. Let's look at the second scenario from the Tibb perspective as to how illness conditions manifest itself. This looks from an accumulation of excess abnormal humours. Accumulation of excess abnormal humours over the period resulting from poor management of lifestyle factors, obviously especially diet, And also poor elimination is also a major cause. Now this again comes from Hippocrates, the father of medicine. His principle of physis, and he believed that all living organisms grow at the expense of the environment, taking what is necessary to survive, such as food, oxygen, etc., and rejecting what is unnecessary or harmful. For example, toxins, carbon dioxide, negative emotions, etc. It is the effective digestion and elimination of this environment that constitutes health. If not, results in disease. Interestingly enough, the environment, as mentioned by Hippocrates, is essentially the lifestyle factors. Also interestingly, Hippocrates used the word physis to describe digestion and elimination of the environment, which, as mentioned earlier, is basically the lifestyle factors. And he mentioned physis, highlighting that poor elimination will result in the buildup of excess abnormal humours beyond the ability of physis to cope with. The term dyspepsia is still commonly used today to describe digestion. However, when Hippocrates coined this word physis, he was not only referring to indigestion associated with the gastrointestinal tract, but digestion and elimination of the Tibb lifestyle factors, as he termed it, environment. So finally, elimination of excess abnormal humours is an important consideration in the management and treatment of illness conditions. Now, looking at the third aspect of how illnesses are caused from the Tibb perspective, when it comes to infections, Tibb had a different viewpoint on infection than Western medicine. Without today's advanced technology, Tibb physicians were unable to detect and identify disease-causing agents such as viruses, bacteria, fungi, etc. However, they were well aware of the nature of infection, or as they termed it, putrefaction. They knew that there was something in the air or water that was responsible for causing specific ailments such as tuberculosis, pneumonia, meningitis. Tibb considers that any illness condition or ailment which we succumb to as a result of infection is only possible when our inner healing power of physis is weakened or it is overwhelmed. So, infective microorganisms will only thrive or multiply and infect our body when a change in the humoral balance provides a fertile and welcoming medium for them. This explains why some people are susceptible to bacterial infection and others are not. As long as the person's humoral balance is in sync, then infective agents will not be able to cause an infection. Now let's look at the final route towards how illnesses are caused. Obviously, and today very common, from the use of conventional Western medication. The use of conventional drugs in Western medicine is widespread. This we all know. And many individuals are affected by side effects in the short term, such as stomach upset, dizziness, and nausea, for instance, or long-term adverse reactions like increased risk of diabetes, asthma, and hypertension. These days, patients are increasingly seeking healthcare advice for illness conditions which result from the long-term use of Western medication. This is often aggravated when additional drugs are required to deal with the side effects and adverse reactions from the previous drugs. For example, when individuals take an ACE inhibitor to lower high blood pressure, they sometimes develop a chronic irritating cough. Another example is when diuretic is prescribed for edema or raised blood pressure, gout may develop. This is then treated with allopurinol, which in turn brings on further side effects. Bottom line, each time a person takes a new medication, the side effect profile increases, unfortunately. In conclusion, from the above discussion on how illness develop, there is no doubt that unlike in Western medicine, where the causes of many illness conditions are known, the Tibb philosophical principles allow for a comprehensive understanding of identifying the causes of most illness conditions based on the temperamental and humoral theory of Hippocrates, Galen, and Ibn Sina. Moreover, it needs to be noted that most illness conditions have been successfully diagnosed and treated in Tibb for hundreds of years based on these philosophical principles of Tibb. Thank you.